Hello, I'm Gary. Welcome to FYPC. It's my channel about my prostate cancer journey. Hopefully helping you to demystify the journey and understand what might happen to you if you're in a similar position to me. This week we're going to talk about the nuclear medicine bone scan, which sounds really impressive, but it's actually one of the simplest procedures that I had. So let's dive in and find out what that's all about. So, alongside the biopsies, the consultant says to me, one of the other things we want to do is just make sure that we can't find any traces of cancer anywhere else in your body. Because one of the things that happens with prostate cancer is that it can break out of the prostate and go elsewhere. And one of the places that it goes to is the bones. And so you have a nuclear medicine bone scan, or just a bone scan, it may be called, just to check that that hasn't happened. So this is nice and simple. I get the call to the hospital, I go up there and I sit quietly with a nurse while she injects me in the arm with a tracer chemical. Now this is a radioactive tracer chemical, so they say things to you like, you know, don't cuddle anybody and don't sit a child on your lap for the next 24 hours. But that radioactive tracer spreads throughout the body, and I had to wait maybe, I don't know, 2.5, 3 hours I think it was, whilst that procedure happened. And you go back into the scanner room, there's a nice bed to lie on. I wasn't wearing a gown, I just wore my normal clothes. And the scanner comes down, it's quite close to the body, but you sit there very quietly and the scanner moves so that you can, it takes a full picture looking for the traces of the tracer to see if any metastatic cancer is present, any cancer that's spread outside of the prostate. Nice and quick. I think I was in there for about 20 minutes and the results came back fairly quickly, not right there and then, but not long afterwards, to show that there had been no metastatic spread of the cancer. So in amongst all of this biopsy activity and working to make sure that we could be sure about what was going on in the prostate, this bone scan sent a nice positive message that there was no metastatic spread. So a nice easy part of the process, but an essential one, and if you're called for a bone scan, that's exactly what you'll go through. So I hope that was helpful, just to let you know what goes on. My aim for this channel is to spread the word, so do me a favour and like the video, and also subscribe to the channel, share it with your friends. What I want to do is get the word out there so that people understand what prostate cancer is, and by doing that maybe some people will go and have a checkup, and God forbid there is any cancer, but if there is something there, we'd like to catch it as early as possible, and that's one of the aims of the work that I'm doing on this channel. So thanks for watching, and I'll see you next time.